everybody, today.
What's happening here? I look like Jimmy Neutron.
Hey everybody, today we are going to be wrapping up our three-part series where we've been talking about what hearing aids can and cannot do, and today we're going to be talking all about expectations.
Hello again, I am Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about everything surrounding audiology.
Yep, and if you're not sure what audiology is, make sure to hit our like button, subscribe to the channel, hit the notifications bell, and we'll tell you all about it.
All right, today we are in part 3 of our 3-part series. We're going to be wrapping up this discussion that we've been having surrounding what hearing aids can do for you, what you should expect them not to do. And today we're just, like I said, we're going to wrap it up, summarize it, and we're really going to focus on the key in all of this, which is expectations.
Yeah, we talk a lot about expectations with our patients, and the reason for that is if it's like with anything in life, if your expectations are set appropriately, then you have a tendency to do a little bit better with whatever the treatment plan is going to be. So in our previous episodes, we've talked about what hearing aids can do, what hearing aids cannot do or won't do for you. Mm-hmm. And I think part of that, when it comes to expectations, I think an important part of that conversation has a lot to do with the performance levels of the hearing aids. Mm-hmm. Every manufacturer has different levels of performance or levels of technology. Mm-hmm. And similar to any other type of electronic or consumer electronics, each one of those levels of technology is designed to do something different than the others.
Exactly, and it's important that you speak with a provider about your listening needs so that we can determine or help you determine what product would be best for you. A basic end hearing aid and a premium hearing aid and everything in between, they're going to function the same in terms of giving you access to sound and giving you enough power, enough volume, so that isn't determined by the level of technology. It's really what that computer chip is allowing us to program, but also how it's processing things like background noise.
Right, yeah, I always tell patients it's the higher the level of technology, several things happen. They get smarter. Mm-hmm. They're more able to do things for you rather than you having to think about programs and things like that. There's more automatic features. And they get better at processing difficult or complex situations.
Exactly.
They also get more expensive.
Mm-hmm.
I mean, that's a fact.
Right. And it's all just about setting up expectations. Again, and having this conversation with a provider is so important because you may have a couple, key things that you really want your hearing aids to do for you, and we want to make sure we address those needs. And so just making sure that you're getting the right product to help you with your listening needs is the most important thing. And again, it's just expectations and knowing what those products will do for you.
When you talk about expectations and what we expect the hearing aids to do, or what a patient would expect the hearing aids to do, let's talk a little bit about how to plan those expectations out. In other words, I tell patients that we want to plan for either plan for the things that you are doing if you're busy and active and things like that, and knowing that you struggle in those environments, or plan for the things that you would do if it were less difficult. I have a lot of patients that'll say, I don't go and do these things anymore because I just can't hear in those environments or can't communicate, so I just find myself not participating. But we want to set our expectations or our recommendations anyway in line with what we want our lives to be, so that we can improve those communication situations to the point where the patient can feel more in control and go back to living their life the way that they want to.
Right, and there's a lot of extra things now that we can recommend that will help you have a little more control in those situations. There's a lot of accessories that compare to your hearing aids that allow better communication, for example, in a one-on-one conversation but in a busy restaurant. There are assistive devices you can use with the television that hook up or Bluetooth connect to your hearing aids. Your phone is a great tool to help you in those difficult listening situations. So I think that's an important conversation as well, just to know where you're having the most difficulty or where you'd like to see improvement. Like Michael said, what would you be doing if you could hear better? And then on the flip side of that, also having that conversation to, again, set up those realistic expectations and to say, all right, this is a situation where I am having difficulty, and I'm going to expect that although we should see improvement, we're not going to see perfection in this particular situation. And that's a very, very important and difficult conversation to have.
Sure. Yeah, with hearing loss, like other sensory issues, there's no silver bullet. There's no just perfect fix, and it's not always, rainbows and butterflies and sunshine. There are still going to be situations where you're going to notice some difficulty, but the idea is that we are that the pros far outweigh the cons, and when we have our expectations set appropriately, and we've got the recommendations and the actual devices themselves set up appropriately for the benefit of the patient, we can get a lot of butterflies and sunshine and rainbows in some of those situations. I think it's really important, and I know you do too, to talk a little bit about how the provider fits into all of this. We've talked about in past episodes several times actually, where we talk about, what's the most important part of this? Is the most important part the hearing aid? Is the most important part the expectations or the patient or the provider? And I think that the most important thing is all of them and how they come together. Research time and time shows us that having a provider helping guide the patient through these difficult situations improves outcomes nearly every single time.
Oh yeah, you're going to be set up for a better and more successful experience if you have a provider that you're comfortable with and that can guide you through everything, like Michael said. And think about it like when you first get the hearing aids, there's a lot of information there, first of all, but what about 6 months, a year later? What if your hearing changes? What if your day-to-day life changes and you need advice, counseling, programming, recommendations? You need to go, be able to go somewhere where those things can be taken care of by a provider. And so it's so important to have that in your hearing healthcare journey.
Right, and just to take that a step further, it's important to remember that it doesn't necessarily make all that much difference where you buy the devices.
Right.
I mean, you can you can take risks and buy hearing aids online or in big box stores, or there are all kinds of places where you can get hearing aids or amplifiers and soon enough over the counter hearing aids. But incorporating a provider into that situation or into that journey can improve even those experiences as well. You don't always have to buy the devices from the provider. And if the provider will not help you unless you buy hearing aids or devices straight from them, maybe you want to find another provider because they're not perhaps addressing the issues that you need to have addressed. As a wrap-up, we talked a little bit about what they can do, what hearing aids can't do, and the importance of having appropriate expectations in there. When you understand all of that together, your experience with your hearing loss journey or your hearing journey, once we decide to treat that hearing loss with hearing aids, will be much, much better.
Absolutely. And if you can think of questions surrounding this topic or any other topic, or if you have ideas for topics you'd like to hear us talk about, give us an email, info@hearwv.com, or you can call us at 304-428-2403. Don't forget to like and subscribe to our channel, leave us a comment, share with your friends, and we will see you all next time. Thank you.
See ya.